Good day, everyone. Hello, everyone.
Hi, Anelia.
Hi, Sagir.
So, did you see how many registrations for today's meeting, Anelia?
Yes, we have over 70 people registered for today's meeting.
Okay, I think that sounds good. Let's see how many of them joins. Welcome. Maybe we can wait for 1 to 2 minutes before we formally start.
Yes, maybe good wait about 3 minutes more.
Okay.
Hello.
Hi, Regine.
Hi, Dr. Sagir. Hi, Anelia and Suzanne. I think Anelia is with us.
Yes.
How
Hi,
are you,
Reggie.
Anelia? Hi, Mirai. How
Hi,
are you?
everyone. Yeah,
Hi,
thank you so much
everyone.
for joining.
We are already 13 people, Sagir. Good.
Yeah, so I think we can start. Okay.
I think people are just
Yeah,
coming.
we may find some more people, and it's Saturday. So
Yes.
we hope
So
that
we have dedicated people.
exactly.
Gabby is here, Claudia, Barry, Sandra, Apostle, Richard.
Hi, good morning.
Hi, Edith.
Hi, good morning to
Forward
everyone.
to see you, most of you in Honolulu. And in
Hi,
the
Claudia.
SIOP, they invited me to give a speech on how we learn from our experiences. I would try to do it as a TED Talk to inspire the young SIOP. Good.
Right. So you guys
Okay.
can see my slides?
Yes. I think you can show, yeah, now it's better. Yes.
Yeah, okay. So Good morning, good afternoon, good evening, all the participants of today's SIOP Global Health Network Annual Assembly, which is virtual for the first time. It's only virtual. We used to have hybrid. So it's Saturday. So I'm really grateful for those who are sparing time and participating in this activity. So we did it virtually because of two reasons. I just surveyed amongst the working group leaders, and we found out that it's less than 50% of them, they are actually joining the in-person meeting. So probably we were not expecting a good quorum. And secondly, there is no virtual component, no live streaming of this Congress. So probably those who are not attending probably were not able to join us in the annual assembly. So Federico and I decided to make it as a virtual event. So thank you again for joining, and we would have a very live discussion in this session, hopefully. So this is the agenda. You know, comparing with our discussions in Ottawa last year, so we have got some transformations in the meantime, some changes which we need to share with our participants today's meeting. We did a SWOT analysis, so we will just go over the key features. And then what we are doing in the 2024 Congress in Honolulu. And the most important part, as always, is the working group reports. We will just listen to them. The working group leaders about their activities and their plans, and what the leadership strategies, membership engagement strategies that we will discuss as an interactive discussion. And then there is something like a new initiative coming up from GHN that is called as discipline. We will discuss it further. I invited Michael Sullivan to just share a brief update on ARIA and then other points. So we don't have the opportunity to do the group photo, which always we do in the live meetings. So we will do it here virtually. So stay with us to take that virtual photo in the end. So because it's an open forum, so I will request all the participants to just keep their microphones muted. And if there is any question or any comments, then you can raise your hand or write it in the chat box. So I will request, because Federico is not here, so may I request, you can see if maybe Dr. Ahmed, if you can just take any note on the chat, or Bilal, because sometimes while displaying the slides, you miss some key points. So just if you can just, help me in, help us for, just taking those points.
And I think Dr. Sagir, Anelia has put the artificial intelligence on, right, Anelia? So we will have a recording and the minutes written, right, Anelia?
Yes, so we have our
Good, good.
recording. Yes.
So it will be a second double check, yeah.
Right.
Yeah.
That will be great. Thank you so much. Thank you.
And I think the AI is transcribing the meeting as well.
Yes, but for the live session, maybe if we find some quick questions or important questions, we can just make it interactive. So instead of, one person talking. So let's be interactive and keep all the participants engaged, and we go for discussions wherever needed. So once again, welcome to all participants of today's meeting, all the GHN members who have joined, and it's like 1,058 members as of now on SIOP Connect who have joined SIOP GHN. That's an amazing figure. If you see, these are all SIOP members who are the part of GHN. So I welcome all the working group coaches and all other members. We got some apologies, particularly Federico, because his mom, he has some family issues. His mom is admitted in ICU. So we have feelings and prayers for her recovery. Then Caitlin and Trin is real, and Guillermo is also in the flight. So we got these apologies. And Ilya, we got some other apologies also from the registration link or somewhere.
Only those who you already mentioned, Sagi.
Okay, okay, right. Thank you. So just going over, if I think everyone knows about the PODC and GHN who are on this call, but if there is somebody new, so I will just highlight that it was a PODC, SIOP Pediatric Oncology Developing Countries Committee, which was initiated in 1990s by late Professor Hans-Peter Wagner and Peter Hasling. You can see the picture of Professor Wagner, who got the Lifetime Achievement Award in one of the SIOP Congress from Eric Buffet. So he was the key person who actually initiated all this, what's happening. So we transformed its name to change the name to Global Health Network because of several reasons. And the GHN focuses on addressing the unmet needs of children with cancer by fostering practical guidance for delivering cancer care for healthcare professionals caring for children living in low resource settings. That is the change we have just introduced in a year or so in this transformation process. It was low middle income countries, but we put it like low resource settings, but because the low resource settings can exist in any country of any income status. So SIOP GHN has evolved into a global forum for multidisciplinary collaboration on research, education, and advocacy in line with SIOP's vision and mission. In a transformation process for better alignment with SIOP strategic goals, we have been working a lot on this in this regard in last 1 year or so, and we will discuss in the next few slides over it. We have 7 active working groups. The co-chairs are from LMICs and HICs. That is mandatory for GHN as well as the GHN working groups. We have internal collaboration with SIOP's other networks, and we encourage engagement with external stakeholders or organizations who take care of children with cancer. So as I said, we have more than 1,050 members on SIOP Connect, which is a good number indeed. And we hope that we would have more numbers who are interested in global health issues on pediatric oncology. Okay. How we functions, what is the scope and the mandate? You can see the working group is the functional unit. You can see the 5 goals of SIOP, existing SIOP mission. We strive to align it with the SIOP strategy and engagement with the other continental branches. SIOP Connect has done a lot for this helping us in this transformation process because it provides a good portal for engaging, interacting with within the network and within the working groups with the members, sending the invitations for different activities or any invitation for engagement in the activities generated by the working group and the network. And you receive a lot of emails from GHN and its working groups on various aspects. Most recently, SIOP GHN has a WhatsApp group also. You can see the QR code. I put it there and also the link. So if you're not a member or whosoever is a SIOP member is not a member, we invite them to join us and get updated about various activities. So most recently, the most important thing which we have done is the revision of terms of reference based on the changes which have taken place over last few months. So thank you for the working group leaders as well as SIOP Governance Committee, particularly Dr. Ejin Kebudi and Guillermo for their key feedbacks and completing this revision process. So how we function, we have the GHN members, which are the working group members also, which are connected with the working group leaders. Then we have internal collaboration within the same working group and with other GHN working groups and SIOP networks and committees. We will see some examples in this presentation. Then we have 2 GHN co-chairs right now, although there are some changes going to take place. I will just highlight those. And then the GHN co-chairs are the part of the SIOP board, so they are connected with SIOP leadership and updating and sharing the progress done by the GHN. And then the collaboration with external partners like IPSO and PROS and many other entities like St. Jude's projects or something like that. So these are the working groups, 7 working groups I just shared, which are quite active right now. So the revised terms of reference. So I tell you this revision of terms of reference, which was a big endeavor last year because we updated we revised the terms of reference after 7 years, I think from 2016 and then 2023, but we have to modify it further because of the recent transformations. So the key points which I shared the terms of reference document in the WhatsApp group if somebody wants to just go over and see and comment. So right now, as I said, we have 2 elected co-chairs with at least 1 co-chair must live and work in an LMIC. That is called as LMIC co-chair, while the second co-chair can be from any income setting, that is called as journal co-chair. So both co-chairs are members of SIOP board of directors. That will be continuing until October 2025. So after that, from the Amsterdam SIOP Congress onward, there will be only 1 elected chair who must be from LMIC, and he or she will be the board member. And then we are introducing the elected vice chair, who could belong from any setting, but that will be not a board level position. So how we will be transitioning next year when I'm going to step down, that Federico will continue as the chair of the GHN up till his end of term. And we will be going for the elections for the vice chair next year. But for the working group, at least there is another change about the working groups, which is held as a mandatory element, is that all working groups should have at least 3 non-Congress activities each year, which is different, which is that is not other than the SIOP main Congress. So all working groups, they need to do at least 3 activities. They can do many more than this, but at least 3. So this is something new in the terms of reference. And then we established a course sharing group in 2022, 2023 from Barcelona Congress onward. So just do the governance and decision making of the SIOP GHN businesses and other things. So we just changed the structure of this course steering committee for this 1 year. So this CSG serves as a governance and decision-making body of SIOP businesses and decision about activities during SIOP Congress. So the composition of this body will be both co-chairs of GHN until October next year. Then it will be both chair and vice chair. Then 1 co-chair of each working group, preferably the senior co-chair. The term of the working group co-chairs to represent as CSG member will be 1 year from one SIOP Congress to the next Congress, and shuffling will be done annually if needed based on seniority. So I congratulate and appreciate that these are apart from Federico and I, we have 7 representations, 7 representatives from all 7 working groups. You can see it's Michael McNeil, Gabby, Caesar, Ahmed, Ayushi, Caitlin, and Bilal. So they will be serving us as GHN CSC members for 2024-2025. Then we had a steering group which was actually not that functional, and we want to make some some active engagement. So we have changed it to the advisors group, SIOP GHN will seek advice from the GHN advisors group. They won't have any voting rights for the active issues. So that group will meet at least annually, but maybe more frequently when required, and will advise on strategic goals, planning, and action relating to the GHN. So composition of this group will be the GHN co-chairs, and then the chair and the vice chair, then all co-chairs of the GHN working groups, all former PUDC and GHN co-chairs starting from 2010 when it was, there was a transformation, major transformation in PUDC. So it will be Scott Howard, Trin Israel, then Ramandeep Arora, Alan Davidson, Julia Chelinor, Sandra Luna Feynman, and Michael Sullivan. So they will, and Alan Davidson. So they will all be the part of the advisors group. And then up to 6 nominated members, and the eligible nominees will be the former GHN working group co-chairs, and that will be formally endorsed by the CSJ. So we haven't invited the nominations as yet, but we will do it before this Honolulu meeting. And then there will be ex-officio members comprising the SIOP president, secretary general, and 6 continental presidents. So that will be the advisors group for SIOP GHN. So I don't see any questions or comments or any hand raise in the chat by now. Okay, so if any questions or comments or suggestions before we move to the next part. Okay, so the working group leadership. So those I showed in green are the newly elected working group co-chairs. Congratulations and warm welcome to Mire Yildirim from Turkey, then Njoki from Kenya in PROS working group, and then Rosanna for AYA working group, and Alisa for psychosocial well-being working group. And those who are shaded in purple, they are outgoing working group co-chairs. So we're just in the process of nomination and elections for research and innovation working group. Venki is going to step down, and then traditional and complementary medicine, Muhammad Al-Kudimat, and partnership, Anita from India. So we are in election process. So we deeply appreciate and thank the leaders who are stepping down. They have done a lot of contributions. So in our traditional in-person meetings, we just present the certificates of appreciation. So thankfully, Suzanne and Anelia, they have prepared the certificates. So we will send all the ones who have completed their leadership, the co-chair term in this year, including the 4 positions which are already taken up, and 3 positions who are actually been vacated, and the new are coming up. So we will send the certificates of appreciation in PDF, but there will be certificates, hard copies available during Honolulu meeting. If you are there in person, you can collect those from SIOP booth. So again, thank you so much for all your contributions and help. So those who already been replaced earlier this year, including Resham Shahzadi in palliative care working group, then Janet Parks in PROS, and then Alicia from AYA, and Nicole from psychosocial well-being working group. We all appreciate their all contributions for GHN. So what's coming up? As I said, already nominations and election process for research innovation, traditional and complementary medicine and partnership working groups are already in process. And I think we would have the results before Honolulu Congress. So for the GHN co-chair position, I'm going to step down in October 2025. So the nomination and election process will start in March 2025, but that will be, as I said, it will be vice chair position. So anyone from any income status can come forward to run for the elections. But of course, the election rules are that that must not be like 3 candidates. So if there are more candidates, we just go over and find the final slate, and then the election process starts. It's not only for the GHN co-chair, but also for the working group leadership. So there are a lot of changes in the working group co-chair positions also in 2025. So the same March, April will be the time for the elections, but there will be like 6 months of transition and endorsement time. So research and innovation, Caitlin will step down, T&CM, Ahmed will step down, partnership, Caesar, Pros, Bilal, palliative care, Michael, AY, Gabby, and psychosocial, Ayushi will step down next year. So if you are interested or you want to nominate, so be ready in 6 months' time to come up for these leadership positions. So this is the first part. It's about transformation and the current status of GHN. So if there are any thoughts or suggestions or comments, I will really appreciate. Okay, so I don't see anything in the chat right now. Yeah, Michael's hand says. Michael, please.
Oh, thanks, Sahir. I just want to congratulate you and Federico for continuing to lead the Global Health Network through this very important transition, but also with the revised terms of reference. And I think that the inclusiveness of the widest group of advisors and supporters is really well thought through. It's been a long time, so congratulations.
Thank you so much, Michael. And I remember the hard work we did for last year's terms of reference. It was not that difficult this year, but you know, it was a huge task.
I will also.
Yeah, Rajan, go ahead.
My microphone is muted, I think.
Okay.
Can I talk,
Yeah,
Sagir?
please
I'm
go ahead.
driving, so sorry, I cannot put my raise hand sign. So I would like, first of all, I would like to thank Dr. Sagir for this opportunity and this the business meeting now, and also would like to thank both him and Michael for the last term, and now him and Federico for the new term. And during this transition, making the terms of reference, discussing all what has been done, what the membership wants with the SWOT analysis. It took some time, but it was really very great effort. Thanks to him. And we as the leadership UN, we together, of course, are always supporting the GHN, which is a very important component of our SIOP. It was PODC, low middle income or low resource settings. Now it is the whole world that has all these problems, but we always want to include all these problems in low middle income countries a lot. So that's why, as Dr. Sagir has said, one of the co-chairs has to be from low middle income countries, and that one will be the one that will be represented in the board. Thank you, Dr. Sagir.
Thank you so much, Dr. Rajan, for your support and kind guidance. being a general secretary and also leading the governance committee. So thanks for all your help and advice and guidance.
Always.
Okay, so thank you so much for those who participated in this SWOT analysis, which took place earlier this year. And we find a lot of good stuff to instruct ourselves or guide ourselves to go take the way. So I just put the key inputs we discussed in last quarterly business meeting. I'm just highlighting it for the GHN Annual Assembly also. So we got, if I say we got 10 comments, so 9 were about education. So people are asking for more education, though we are providing some opportunities, but there are more and more eagerness to get more educational avenues, particularly disease-specific or tumor-specific education that is asked a lot by the SWOT analysis participants. And of course, about treatment protocols and resource adaptation. So this is a question for low resource settings folks as expected. So this was the key finding about what the folks are interested in. And then research, low resource settings, and the clinical trials, instructions, and guidance. So thankfully, we have a research and innovation working group. So Venki and Caitlin have done a lot from day one of its inception. And I think there will be a lot more to be done for this very regard. Members' engagement is very important. I don't know, we were discussing last time and we didn't see that so many participation in the quarterly meeting, and same is here today. So more than 50% people, which we might have to make them realize, but the only way is the SIOP Connect. They are not aware about they are part of GHN, but how the GHN works. So maybe through the working groups, we have to make more engagement. Other disciplines, surgeons, pharmacists, nurses, and policymakers, there was a thought that we should engage them. And regional collaboration was asked for, and SIOP Connect probably we have to make it a more utilized. This tool need to be more utilized by the SIOP members and the SIOP GHN. There was some ask about survivorship guidance or the working. Thankfully, we have a survivorship network, which is just added recently within SIOP structure. So those who are interested, they can join that network. And the people asked about essential medicine. So we have essential medicine working group also, which is part of WHO committee. And we have some part, Federico is representing there. So we have active engagement. So probably GHN can do much in that regard also. Then some audit, which was done in SWOT analysis, and that thankfully these were all key points, and the working group leaders particularly, they must consider these. It should not be a single-handed activity with minimal engagement, which was there unfortunately before SIOP Connect. Between the time after we left Cure for Kids and launch of SIOP Connect, there was some glitches, there were no proper engagement, but probably there is no excuse now to be only like 2 working group co-chairs, they are doing all the things, even the GHN co-chairs only doing the things. So it will be all engagement which we need to have. So different pace and activities across various working groups. Yeah, that was really happening, and some working groups were very active and some were other way around. But now with making it like at least 3 activities, non-Congress activities, probably that will stop that dormancy things in the working groups areas. And probably I think all working groups right now, all 7 are engaged in various activities. But of course, we need to have much more than what we have, I hope, in next years. Not to focus on their own countries only. Yeah, there is only, it's a global health network. It's not a country-related network. So we need to have more engagement and activities which are beyond the country or region's bindings. Rather, it should go further beyond. A working group left without guidance and opportunity. So because the numbers of the working groups have decreased quite a bit, because at one time it was up till 18 working groups. So we are much better connected. And now in CSC, there is representation of 4 working groups. So probably we will keep in well connections, GHN co-chairs as well as the working group co-chairs representation in CSC will make it sure that all working groups are quite engaged together. And educational repositories, I heard that something is being built in the SIOP Connect, as we used to have in Cure for Kids, to just upload some documents or some notes or new literature or papers or something like that, or even videos. So probably we will get some enhanced functions on SIOP Connect soon. Lack of engagement and ownership opportunities. That is I think that is also important. Ownership is of course very important, especially for the working group members, and should be more inclusive and action oriented. Of course, that's very true. So it should not be personal, projection or personal activities. Rather, it should be the working group activities. And disease-specific education, online tumor boards, and early diagnosis. This is also asked for. We put some solutions for it. I will discuss it towards the end of this meeting. And then some critique based on the findings, that annual log frame of activities and deliverables by working group leaders that was developed by Julia Chelinor under her term of General Secretary, as General Secretary. So probably we should make use of it, just putting the log frame of activities of over 1 year or maybe half year, and just do the audit and make it more organized. Regular and scheduled meetings for working group co-chairs with GHN co-chairs and CSC members, progress monitoring, brainstorming, and guidance. So let's ensure all the leaders, let's ensure together that we will keep connected by the CSC at least, and also we would have regular evaluation and thought sharing and brainstorming about the activities of the individual working groups. Opportunities to collaborate with other networks and committees. That is also, some groups are quite active in this, but we need to enhance that part also. Most GHN members are unaware of how to engage in a meaningful way. Yeah, so SIOP Connect should be utilized to make them aware how they can actively get engaged in various activities. Virtual listening sessions with GHN members would allow the co-chairs to hear from members who cannot make the quarterly meetings. So probably this annual assembly is the good point. We say it's annual assembly. It's not like a typical business meeting, because we invite everyone to join. So that's one of the way, and maybe we can have some similar sort of activities, maybe mid of year or something like that. That's a good point, as the open forum of SIOP is doing. So maybe GHN members can also be engaged in that way. GHN co-chairs should be vigilant that personal research projects are not considered working group output guidance for the members to excel in their research orientation. Yeah, so the working group leaders, based on their expertise or experience, they should try to transmit or share, or just communicate, guide the members to be more active in whatever they are doing, or just try to get them engaged. And advocacy drives with the advocacy committee and other stakeholders is also very important, which we need to take care. Whatever we doing individually, we need to share it with the larger groups within SIOP. I think there is something in the chat. Yeah, I see Adit's comment. She's a part of Essential Medicine Working Group. And she has been a part of PODC. So Ajit, you are always welcome to contribute, or just select whatever the working group, 7 of the working groups where you can contribute. So we always are willing to get your engagement and advice based on expertise and experience. Any other questions or suggestions or comments? Okay, so let's move to the SIOP Congress 2024 at Honolulu. So, so those who are planning to go, I hope that it will be very good place to visit and very good Congress to attend. So first of all, GHN scholarships, which is something very consistent feature based on the abstract submission. So we awarded 20 scholarships as always. It will be worth 2,000 euros to the scholarship. It's a scholarship grant. So we, as based on the quality, the scores, and relevance to the GHN Global Health Network. So we picked 20 scholarships from 16 countries. With the known rubric that maximum 3 abstracts from a country and no more than 1 from a center, and not re-awarded within last 5 years. So you can see the names. We congratulate all the recipients of the scholarship, GHN scholarships, and we wish them a pleasant SIOP Congress with a lot of networking, education, and the stuff. So any comments or suggestions? Yeah, Michael, please go ahead.
Just one additional comment from our region in Oceania. We've not had a successful scholarship from our part of the world yet. So I'm just wondering how we can do that, whether there is some agreement that there should be the continental regions should also be reflected, because we have the Pacific Islands and Papua New Guinea and etc. And these are small island nations and states. So it was just a thought. We did have abstracts and an application this year, and I was mystified as to why that didn't receive a scholarship. Obviously, you've got merit-based evaluation as well. But an abstract from our part of the world is going to really struggle to compete on quality from parts of the world where there are very, very large institutions, etc. So I'm just raising that point.
Yeah, thank you so much, Michael. Yeah, that's quite pertinent. But actually, the process which we adopt for this scholarship. It's very, very stringent sort of activity. I think it was 13 layers we go through with the list of already scored abstracts from the scientific committee or the abstract committee. So far we don't have any categorization of the regions. You can see in the list we have 3 for India, and I think it was like 120 or 125 abstracts from India, which were in the competition list of abstracts. So it's the most number, and then you go below. We got, I think, 2 from Pakistan, and most of the countries are 1 each. So far we don't have any such process to put it like continental wise listing. But there are some proposals came across in the Congress Development Committee, which Suzanne, informally shared with me. So maybe we can find some way to do it in the next year. But as you and I were doing last 3 years, so we didn't have any such any
Yeah.
such guidelines or things. But probably we can do it next year.
Thank you.
Sagir, can
But
I
of course,
have a word?
Yeah,
So-
please go ahead.
Hello. So this is Dr. Regine. So we have also discussed in the senior management and also the governance committee what is happening because the purpose of giving the scholarships is to have these mostly young, but it can be also, we don't have, I'm not sure that we have a age limit, but it's mostly young, but there's no age limit as far as I know for the scholarships, right? People to come to the Congress, to see the atmosphere of the Congress, to get knowledge and do networking, and so that this helps their career and also this benefits the children with cancer in the world, in their region, and so on. And we have been discussing that what is happening with the scholarships. How many of these scholarship recipients are continuing to be SIOP members? What are they continuing to do any work within SIOP, within their region? So to be following more what is the impact of giving these scholarships? And the other thing is that from next year on, we're discussing whether the scholarship recipients should be at least members for 1 or 2 years, not that year. That's if they become a member only that year, they cannot apply for the scholarship. First, let's be a SIOP member, see what SIOP is doing, and then apply for a scholarship. So we have been discussing this as well. So because we want the scholarships to make an impact for the children with cancer in the world and for the people that are doing their career. I don't know if you have any other
that's a
thoughts on
great
this,
point.
you or Michael, yeah?
I
Sorry?
think that's a great point, and
Yeah.
but probably we need to finalize the recommendations before maybe March next year,
Yeah.
because again, the April we will get starting the abstracts
Yeah.
reviewing and all those stuff. So
Yeah.
and there was another point that we can, instead of offering 2,000 euros for everyone, we just
Yeah.
make it like based on the destination from the location from the destination point. Like if it's a Congress in Europe, so maybe Africa, the grant could be lowered as compared to those who are coming from, for instance, Latin America or somewhere abroad. That way we can make it, instead of 20, we might make it like 25 or 30 even. So that's another point. But
Yeah.
of course, Michael, I just understand the point you said, but probably one thing which can be done at continental branches is to guide the youngsters to just put forward their projects or writing the abstract technique or something to make it more worthy and scoring more, because it's not so many countries, especially in Oceania, if you see. So maybe they can contact the continental leadership to get some more guidance for before submitting the abstracts. That could be one way to get some more score and get more eligible to find the scholarships. Yes,
I would also suggest that, Sagia and Regin, that as the membership has grown, I think we should be looking at doubling, trying to get 50 scholarships per year, because we've got many more members, many more countries involved, and we should put that onto the organizing committee, local organizing committee, to increase the number of scholarships that are available.
Yeah, dear Michael, yes, this has been discussed also. Of course, this needs funding. So it should be, we have to find the funding for this, whether from the local organizing committee, especially we want that the local organizing committees are trying to find more funding for the scholarships. And as Sagir said, maybe giving the scholarships according to the new site, so that people that have the flight costs are quite high, having that kind of a stratification according to regions as well. So the leadership is working hard on it to increase the number of scholarships, to make impact with the scholarships. So it's not one person gets a scholarship, because we have discussed that sometime it was a pediatrician, that's okay. But this afterwards, she is not even she or he in pediatric oncology. And so we want the SIOP scholarship to make an impact for pediatric oncology in the world. So,
Yeah, so
we
that's
have to follow the scholarship recipients, yeah.
That's a fantastic point, because as we know, half of the world's children with cancer are cared for by general pediatricians or lead pediatricians with an interest, not pediatric oncologists.
Yeah.
And we need to encourage and foster that part of our professional colleagues.
Yeah. Exactly. Yeah. Thank you.
Yeah, that's point which Regin, you shared about how we can get them engaged in SIOPS activities. That's $1 million question, because since the Julia and Alan Davidson, we have been discussing about engaging them in various activities, but I don't know how to do it. Of course, we are open, like GHN is open for everyone to come and join. But I have seen many people who just come for one Congress and they don't appear later on.
Yeah.
So how to do it? Probably we might have to do more brainstorming on this.
I think the non-Congress activities that each working group has to do, at least 3 non-Congress activities, is attracting more members. Because in the SWOT analysis, it was many people said education, education, education. And I have been seeing in this last year, at least, there have been a lot of engagement in the webinars. So we have to offer more as SIOP to the members, so that they know that SIOP is not only the Congress. It's a year-long activity in pediatric oncology, whether education or other things, like the projects. There are the fundings for projects for networks. So when they are networks and they have brilliant ideas, they can apply for that. I think we have to emphasize these points more and more. And we will be telling about this in the annual business meeting in Honolulu also, but our membership has increased to 3,500, to more than 3 for the first time. So I think we will be doing it. Yeah, we're improving. But we need a lot more. We need a lot more. Yeah.
Exactly. Maybe that could be a food for thought for our research and innovation working group.
Yeah.
Maybe those who got the scholarship, they might be engaged for presenting their abstracts in maybe webinars, and just putting discussion about how they can publish their studies or something like that. So could that be a great avenue? Maybe Caitlin and Vanki or whoever is coming up as a new leader, they must take this point as something. Maybe we select this lot of people who are getting scholarship this year, how we can just get them engaged, and from here on we can do some strategies to make them good contributor to the SIOP and SIOP activities.
Yes.
So let's see.
Yes, exactly. Yeah.
So I will propose this to our research and innovation working
Yeah.
group to take this, or maybe other working groups if they want to engage them by any way.
Yeah, in fact, I had proposed this Sagir, because in the ASCO, in the American Society of Clinical Oncology, I am also in the steering group of the International Development of Education Award Committee. And there, that is being done for the last 3 years. The follow-up of the scholarship recipients. Are they engaging? What they have done? I think this is really very important to what is the impact of these scholarships. I think we will work more on it. And what you have suggested is we could have a webinar after the Congress, because everyone is not going to the Congress, like 5 minutes or 10 minutes presentations of the scholarship recipients. Yeah.
And we can follow further. Yeah, that could be one way to go, or other could be that we can see the abstracts maybe at CST level, or the working group leaders, they can see the abstracts and find what they are related to, maybe different working groups, and then try
Yeah.
to invite them as
Yeah.
a active member or do some liaison with them. So,
Yeah.
so that's a
Yes.
good, I think that's a good discussion. Probably we might have to have more in the
Yeah.
future to get them engaged. Thank you so much for bringing this point, Regin, and also Michael.
Thank you.
Any other thoughts or suggestions? Yeah, I see the point by Mireille about membership engagement is also supported by ambassadors. Because it's all related to GHN, so probably we might take lead on this, not only this Congress, but how they can be very good contributor to GHN. And maybe ambassadors can also be engaged in such like activities. But of course, there is no age limit for GHN. It's only for, I think, YSN they take the age limits. But here we made it like 5 years, at least 5 years interval to not get a second scholarship to offer it more folks instead of just recycling it to the same people. And also I don't know, 3 members from 3 abstracts from a country. So India is probably not in that merit list because 125 abstracts from a single country and selecting only 3. So probably we'll have to look into that somewhat anyhow. So maybe we have to do some further discussion before the next quarterly meeting or within quarterly meeting to just make it more useful and more folks to be benefited from this. Anyhow, thank you so much. So then SIOP Education Day, that is 17th of October. It's Thursday. And I hope it will be very productive and very engaging as always. So as we do always, session 1 is best of GHN free paper session. So there will be 2 LMIC abstracts based on the scoring and the impact and the relevance. So one is from India, our friend Venki is presenting, and then we have another one from Ghana. Then we have from Congo is LIC, one from LIC, and the last one is from Brazil, which is UMIC. So we always do like 2 from LMICs, 1 from LIC, and 1 from UMIC. And that session will be chaired by Michael Sullivan. Thank you, Michael, for accepting that last minute invitation, because unfortunately I won't be attending in person. And Federico will be chairing this session. So you can note down the numbers. I just put it like what is on Education Day, and probably to my knowledge, what is more relevant to GHN participants to attend various parts. Then the second session, it's a hard work by Gabby and Lindsay. It's a joint session, Young SIOP, Nursing, Global Health, Supportive Care, and CCI. So it's always in the big hall, this joint session with a very good participation and very good preparation, because I know Gabby started working on this since April. So it's really, really hard work to construct this joint session, which will be in a bigger hall, and you can see the titles of the talks and the presenters. And there will be panel discussion, which is always very interactive and very well constructed. Then our third session is addressing psychosocial well-being of pediatric oncology multidisciplinary professionals. It's first of its kinds in GHN and even the PODC, which is addressing this very important topic. Thanks to 3 working groups who are actually jointly doing it. It's research innovation, palliative care, and psychosocial well-being working groups. It's also very hard work. So it will be moderated by Kathleen and Mireille. Elisa just shared me yesterday that she is not going to make it in person. So we would have 2 co-chairs, and then we would have introduction and the video messages. We are doing we just requested Julia Chenenor to just share a short video about the experience of burnout and how she coped it in her lifetime. And then we would have exploring the dynamics of burnout in varied resource settings, a talk by Ayushi, the co-chair of Wellbeing Working Group. And then caring without caring, without caring, self-care, resilience, strategies to address burnout, compassion fatigue, and moral distress by Michael McNeil, who's the chair of Palliative Care Working Group. It's basically his idea to do on all this stuff, and it's like a very thoughtful discussion. Thank you, Michael, for leading on this. And then we would have an interactive session led by Leanne Embry from US, and then Venki and Claire, along with speakers and moderators. And then there will be discussion and videos and lessons learned. Might be we send you a short, quick questionnaire, which Kathleen is working on before this session. So I will appreciate if you give your feedback on this. So it will be it's very exciting session to me, and hopefully it will be very well met. Then the last session, which is probably very close to our strategy. I say it's a strategic session for GHN, disease-specific learning and education based on SWOT analysis, and I'm going to present something in the later part of the meeting about it. So we originally it was Guillermo and I who were supposed to chair, but Guillermo is busy in some very important meeting conflicting with that time. And because of my absence. So we requested, again, very thankful to Ramandeep, Arora, and Gabby to take the lead for chairing this session. We invited Noreen Mushtaq from Pakistan, talking on pediatric brain tumors, then Trin Israel's on Wilms tumor and retinoblastoma. Just Barry from US, she's lead of International Society of Ocular Oncology. She will be talking on retinoblastoma. And then there will be a very interactive panel discussion, joining forces for better global outcomes of curable cancers, with Scott Howard, Catherine Mette, and Federico Entelon. So please just disseminate this very session amongst the folks. Probably that will be very, very good interaction, and that will be a soft launching of what I say, this plan, which we will discuss in a few minutes' time. We designed another special session. This is still in a finalizing phase. Is updates on global pediatric oncology campaigns, moderated by Federico and thankfully Kathy Pritchard-Jones, where we are updating about WHO, GICC, and the SIOP WHO collaboration. Kathy Pritchard-Jones, then Essential Medicines, Federico himself, SIOP Park, Carl Allen, Global Mapping by Maite, and then ARIA by our friend Michael Sullivan, and there will be some interaction and question and answers. And alongside it, about WHO, GICC, and SIOP WHO collaboration, there will be in spotlight session I'm just going to share. Then there will be Hans-Peter Wagner Award, it's second time it's taking place. It's on Friday, 18th of October. And Ihsan at Savas from Turkey, she will be presenting this talk on effect of biofeedback-based virtual reality game on pain, fear, and anxiety levels during post-catheter needle insertion in pediatric oncology patients. So do join us. It will be moderated, I think, by Guillermo and Asim Belkami. Then in spotlight session, which is the GHN session, it will be like half an hour on Global Health Network, moderated by Federico. And it will be just, extension of that last session and WHO, GICC, and SIOP WHO relationship. Kathy will be part of it. Then we would have GHN's course steering advisors group meeting. This is a closed group meeting on Saturday, 19th of October. Thanks, Suzanne, for providing us this one room, the boardroom for that meeting. It will be only on invitation. Then SIOP award session is taking place on Friday, 18th October. SIOP Annual Assembly business meeting. It will be on 19th October and it will be for SIOP members only. And then I put some highlights sessions which are quite relevant to GHN folks. One is a joint session where CCI, SIOP, WHO, it's access to essential medicine for children with cancer. So it is on Saturday. Then ARIA guide, Michael, I just find it out. There are some product theater activities on 18th and 19th of October. And there are some specific timing for radiation oncology and supportive care also. And then treatment abandonment symposium is taking place on 20th October. That's also quite relevant to our GHN, especially psychosocial well-being working group and those who are interested in abandonment. Of course, everyone is interested in LMICs to learn more about abandonment and strategies. So this is what we have for SIOP Congress. So before we go further, if there are any questions, suggestions, comments, let me mute myself for a moment. Right. So now is the time. We are already about 1 hour. So we would have next 1 hour or so on working group reports and discussion on the engagement, SIOP global health members engagement. And then of course I requested Michael to share something on ARIA in the course of the meeting. Let me request the working group leaders that the order is based on the slides submitted or shared with us. So let me invite Gabby or Rosanna to present on AYA working group. Yeah.
Hi, everyone. This is Gabby. So this is, I don't know if you want to go to the next slide. So this is what we've been working on during 2023-2024. We did a survey through SIOP Connect, and we asked all the Global Health Network AYA members if they were interested in taking a more active role. And we have a selected group of people who completed that survey, and they said that they wanted to. So we've been having more close relationship and communications with them, and they've been helping us to proceed with some of the activities that we're doing. One of them being this one called Charlas de Café, or coffee chats, if we try to translate that into English. And this is a way to advocate for AYA awareness. So this Charlas de Café the idea is to have do some interviews to different people that will be very informal without any type of preparation, like no presentation needed. And we will touch based on topics that they are quite relevant for AYA patients. We just did our first one with an AYA survivor, talking about his experience to transition from pediatric to adult care, and how was his relationship with pediatric oncology while he was being treated. The idea for those will be to create short videos that we will upload into the SIOP YouTube channel and to OncoDaily as a way to advertise or promote our network, and also to advocate for people to know about what AYA patients are needed around the world. We just did our first one, and we have 2 more interviews coming, and we just have to edit those videos and upload them. Then for education, we have a project that started in 2023 that was about to show what were the needs for AYA patients around the world. So we did the first webinar that was about the 5 WHO regions all together, talking about their needs and their success, what things that they succeeded in. And now we are doing 1 webinar per region. We did one about Latin America, and we are in the process of doing one from Asia and one from Europe in 2024. And next year we'll do Africa, and Oceania. And then for collaborations, we are collaborating with all with representatives from all continental branches that they basically are helping us to coordinate all the webinars, the 5 regions webinars that we're doing. And we don't have any research project of our own really going on, but it's something that we're planning to do in 2025. So our plan is to, as I said, continue to work on the 5 WHO webinars. We will launch the Charlas de Café program to broaden our network and research and audience. And hopefully that would also help to increase the membership to SIOP in general. And we will try to still continue working with representatives from all SIOP continental branches to generate more projects. And that's it. If you have any questions or comments or suggestions, things that we can do to improve, we really appreciate it.
Thank you so much, Gabby, for sharing these updates. And this looks quite exciting. I think there is some potential avenue to collaborate with the newly formed SIOP survivorship network also. That's quite close to our AY things. It's, you know.
Yeah, we should. You're right. We should approach them to try to do something together because basically we share a lot of topics or similar issues. Yeah.
And I hope you're quite actively using SIOP Connect for engaging the folks in various activities you have already leading on. So any questions or comments for Gabby or Rosanna from the audience? Right. Also, you remember we were discussing some external collaboration with, I don't know, maybe ESMO or NCCN or something for, just to try to build some connections with them. That could that you remember we discussed in last year in Ottawa. Maybe we can do something on those lines also.
Oh yeah, that would be great. Yes.
Right. Thank you so much, Gabby and Rosanna, and I hope that this working group will be very active in next year or so with so many activities you are already designed. Okay, let me invite Michael or Nire for palliative care working group updates. Yeah.
To be here with you, and I'm very excited to see you in Honolulu at our annual meeting. Michael won't be able to attend this meeting now, so I'm going to present our slides. Michael, and I am Yoder are the co-chairs, and our current number of members is 449, and I think it's about 450 nowadays. I last checked it last week. And so the GHN Palliative Care Working Group is open to all members who are interested in palliative care all around the world. And members can join at any time by going to SIOP Connect, and SIOP Connect is being used by our working group. So we are also using this actively, SIOP Connect, and the working group participated in the Scientific Pediatric Palliative Oncology Symposium last year in September, and also this year in September. All the members, all the working group received registration to the symposium in 2024, and I also attended on site to this symposium. It was very useful, and I think that it was very well structured and will definitely lead actionable outcomes in our working group, I think. And a WhatsApp group has been created for quick communication, which is being used actively, and then many WhatsApp groups were created by the other networks. And we are using this WhatsApp group for making announcements and sometimes sharing relevant publications. And I think this WhatsApp group can be used for planning short meetings on site during the annual meeting, because I didn't write here, but we will have a free room and a short time at the annual meeting for particular working group members to greet and meet and welcome our members and support their engagement with the working group. I think it's going to be very useful for the members and engagement. And working group advocacy is parallel to GHN advocacy to improve access to universal and comprehensive cancer care, which is advocate for age and respect of family and social economic circumstances, cultural practices, and religious beliefs globally and especially in low resource settings. We had educational activities. We had 2 educational webinars. One was in May, and it was by Dr. Kritika Rao. The topic was providing palliative care for children with cancer with a perspective from a large global middle income country in India. And the second was last month, September. The topic was palliative care for children with central nervous system malignancies by Dr. Reshad. And I think our webinars will be more disease-specific palliative care approaches will be discussed further in our webinars. It will be very useful, I think. And we have collaborations. The GHN palliative care working group has facilitated the pediatric palliative care research collaborations on assessing doctors' attitudes on palliative treatment adapt in Southeast Asia, and Europe and China. We have some reader activities. One of them is updating topics for the ARAYA guide, as well as participating in the WHO palliative care work review. And the second, collaborate the research with SIOP Europe, SIOP Africa, and SIOP North America to understand perceptions of palliative care intervention for children with cancer. And there are plans and projects of our working group for the next term. First one is a palliative care educational program that we want to establish. We want to establish and disseminate the proposed scope and applicability of palliative care through a systematically created program. And but we have to go further with Michael about the curriculum and the possible speakers and collaborations. But I think that this educational program will start next term. And we want to, we have a project about training seminars on pain management, because well, this pain management is one of the most challenging topics in practice for many of our colleagues, for ourselves. And courses should primarily be open to participants from LMIT countries, and we will collaborate with volunteer trainers and centers from SIOP networks. And there is a mentorship project in SIOP, and we want to assist in establishing mentorship in palliative care for members in need. And global mapping of provider perceptions and barriers to palliative care integration that will be integrated into SIOP mapping project. And these are the plans and projects for 2024 and 2025. Thank you.
Thank you so much, Mary, for sharing this exciting progress and activities. Any questions or comments from the audience? I have a couple of quick questions. One is like 439 members. It's like it's a good number. So did you find good numbers in the? I'm just curious because it's always not that happening. But how much were the participants in the last session you offered in the webinar form with the talk from Shahzadi Resham?
Okay. The last webinar was in September, and we haven't seen the participants yet, but 45 or 48 participants. And the first one is the similar.
Right. So maybe WhatsApp can, just enhance the communication in addition to SIOP Connect. Because of course we need to have more people engaged in virtual activities, or maybe whatever you are offering, or engaging like surveys and other stuff. Then the second thing, this training seminar on pain management, would that be a virtual thing which we will offer through SIOP Connect or SIOP Office, or how you will do it?
Actually, I have written these training seminars and certificate educational program to my suggestions when I first came into the duty, but I couldn't have had the chance to discuss this with you. So I think these seminars will be on virtually. Maybe some 1 or 2 daily workshops, maybe on site, but it should be more discussed.
So on-site means where it will be with the continental meetings, or?
No, this is discussed further, because this is just an idea. I have emailed you to these my suggestions, but we haven't got the opportunity to discuss further or get some ideas from the GHN. So we're going to discuss this with Michael and the other networks. Then maybe it will be more visible. What are we going to do then? But we want to change seminars virtually on pain management, that's for sure. But maybe on-site courses, I don't know.
Okay, so that needs more discussion, maybe at the level of CSC, or if you need any support from.
Yes,
from
sure, we
GHN,
need. Yes.
I just read a question from Michael Sullivan about, did you map from where the members come from? The countries or regions you find these 439 members?
Yeah, it just seems a lot of members, and where are they all from?
Yes, I have just checked the number of members today. I think it's 440 approximately, and asked the Tessie that what was the number last year, but she told me that there is not information about the past, and also couldn't find the where the palliative care members are coming from. I couldn't see this information, but maybe we can suggest this for testing.
Okay, right. Because I remember traditionally, as a legacy from Cure for Kids to SIOP Connect, that palliative care working group was very active at one time. I think way back in 2019, 2018, and there were more than 150 members with regular meetings on some brainstorming on research ideas or educational activities. So I think there is a lot of enthusiasm and eagerness for people to learn the palliative care, and this group can serve a lot with you two as the leaders. And of course, there are a lot of provisions from Michael based on the St. Jude's offering on palliative care, global palliative care program.
Yes, yes. But this palliative care educational program, I think, will be very useful for the especially for the new beginners to pediatric oncology. I think, because there is a big gap. Also in my country, there is a very few knowledge about palliative care. So I want to establish this palliative care and knowledge in a really systematical way. So maybe it will last for about 1 year period, and maybe we're going to take the participations by application. Maybe we can give a certificate after the completion of this program. yes, they should be more discussed further, but this is, I think, a very good program, very useful.
Dr. Sagir, can I just
Yeah,
continue?
please.
Yeah,
please
thank
go.
you, Mirai. Thanks to Gabi and to Mirai. Very good presentations, well done. Although it was a very short time since Mirai was elected, they have completed 2 webinars, as we have said. And in fact, Mirai is a pediatric hematologist oncologist for 9 years now, but she's also a PhD student in our Istanbul University supportive and palliative care PhD program. So she's quite involved, and she has received the ASCO, the American Society of Clinical Oncology Palliative Care Award last year, and had a training in the United States for this subject. So I think it is good that, as you say, palliative care is needed a lot in low middle income countries. And so the webinar started one in India, one was from India, one was Pakistan. So it is really good that to see what's going on in low middle income countries in palliative care, and to promote and emphasize that palliative care is needed in every country, not only high income, but every country from the beginning of the disease. I think this is that is something good that we have to emphasize. Thank you.
That's phenomenal. Thank you so much, Dr. Mirai, and thank you, Dr. Ajin, for introducing. It's a great achievements, and we wish you all the best leading this group forward. So hopefully it will be a lot of achievements under this group under your leadership. Thank you so much, and thanks for contributing to the session which we are doing on disease specific. On the psychosocial burnout session 3. The psychosocial pediatric care working group is one of the contributor in that.
Yeah, it is an honor for me because it's the first time that I will be engaged in an international meeting. Thank you very much.
Thank you, and look forward to that. Thank you. Then TNCM, I think we have,
Yes.
please go ahead.
Hello, everyone. I'm Ahmed Farag. Me and my colleague, Dr. Mohammed Al-Qudaimat, are the co-chairs of the Traditional and Complementary Medicine Working Group. During the last year, we have 172 members. Actually, just 39 of them are active. We advocate for open and non-judgmental discussion about TNCMUs with patients and families. During the last year, we have 3 journal clubs, and we have several group meetings for our research projects. We have also collaboration with the nursing working group, especially through Dr. Mohammed Al-Qudaimat as an active member in this group. We have succeeded to finish several researches during the last year. We have just published a publication in the Pediatric Blood and Cancer about the family strategies for managing childhood cancer using traditional and complementary medicine in Southern Egypt. During this SIOP meeting, we have 2 oral presentations, one come from Egypt and the other from Jordan. And we have 1 poster presentation about, it's a qualitative study about the use of traditional and complementary medicine in Jordan. In addition, next slide. It's our pleasure to have one of the keynotes lectures in this type coming from our group. Dr. Mohammed Al-Qudaimat will speak about initiating discussion about traditional and complementary medicine with children and families. Our plans or projects for the next year are to continue and improve our member engagement, maybe through advertisement about our projects and our results from the last year. I think we were successful to do a lot of research projects. We will continue, of course, our journal clubs and ongoing research projects from Jordan, Tunisia, Morocco, and the systematic review and evidence map of TNCMUs globally. Also, we expect to invite experts, speakers from different areas in the world. We will wait for you in the SIOP for this keynote lecture. Thank you.
Wow, wonderful. Thank you so much, Ahmed and Mohammed. It's a really great achievements you have done in over last 2 to 3 years for really reactivating this working group and great activities in research and in club. And now it's really pleasing to see that Mohammed is going to present as a keynote speaker. So congratulations. And this is a good example, I think, for all of us in terms of engagement, because you see 174 members and 39 are active. So it's more than 20%. So
Yeah.
this is a very good proportion. So
Yes, but
I
you're
think we should
effective,
learn,
really.
we all should learn from you guys how you
Thank
just
you.
keep the people engaged. So especially for the WhatsApp group, it's really active, and so many offerings in terms of webinars and other stuff. So great achievements.
Thank you, Mohammed. And maybe it's also a chance now to invite my colleagues from the other working groups, for example, the adolescent and young adults, or also the palliative care team. We may collaborate more together.
Yes, of course, there is a lot of potential. I think that's a good idea.
Thank you.
So any questions or suggestions for Ahmed? Excellent. Thank you so much once again, and warm welcome to the CSG.
Thank you, Mohammed. Thank you.
Psychosocial well-being working group. So I think we have Elisa to start. If Ayushi has also joined. So Elisa is the new leader in psychosocial well-being working group. So Elisa, would you start?
Yeah, I will start. Hello, everyone. It's an honor for me to present on behalf of Psychosocial Wellbeing Working Group as its co-chair. So I'm Melissa, and I co-chair this group with the wonderful Ayushi Kaneja from India. So SIOP is a multidisciplinary society, and I'm really very grateful to the SIOP GHN Network Board that, along with other working groups, we also have the psychosocial well-being one. A little description of the group. This group strives to be a platform of encounter for professionals working in worldwide, but especially in LMIC, in reducing the impact of psychosocial issues that can affect mortality and morbidity, and to improve the quality of life of the children and their families by promoting the multidisciplinary approach of psychosocial aspects in pediatric cancer treatment. Next slide, please. Yeah, so our working group currently has 512 members and in SIOP Connect and 107 members in WhatsApp. So in sense of engagement, during last webinars, we have registered participants numbered around 60. Yeah, and we try to continue increase the number of participants through different activities. And one of our activities are these educational webinars. We had 2 educational webinars this year. The first one is titled Integrated Psychological Care, Promoting Positive Mental Health Across the Pediatric Oncology Illness Trajectory. The speaker was Dr. Nikki Urbergs from St. Jude Research Hospital. And the next one, the next second webinar was presented by our colleague from Peru, Dr. Viviana Tricoso, who was presenting a wonderful presentation on standards of psychological care in pediatric cancer project in LMIC countries, which was very useful in sense of adapting psychosocial standards in LMIC countries. So all these 2, I've put here the YouTube links so that people who didn't join during the webinars can see the recordings of the webinars. Along to this, next one, please. In addition to these webinars, as Dr. Sarir has also already mentioned in his presentation, the Psychosocial Wellbeing Group, in collaboration with the Research and Innovation Working Group and Palliative Care Working Group, is preparing for the Global Health Network Educational Day at the upcoming annual SIOP Congress in Hawaii. The event, which will take place on October 17, is titled Addressing Psychosocial Wellbeing of Pediatric Oncology Multidisciplinary Professionals. And Ayushi will present and speak about exploring the dynamics of burnout in varied resource settings. And some of our future plans. So, of course, we'll continue organizing monthly educational webinars, and we'll try to engage multidisciplinary professionals. So besides psychologists, we will try to engage social workers, child life specialists, spiritual care providers. We'll try also to organize and facilitate multicultural research project to explore psychosocial care approaches in different cultural contexts to better understand and address the challenges faced by pediatric oncology patients and families around the world. We'll try to host case-based discussions forums to create a forum for regular case discussions, enabling professionals, especially from LMIC countries, to share their experiences and challenges. We'll try to organize psychosocial oncology workshop for multidisciplinary teams. Probably it will take place virtually. And for engaging more people in the webinars, we had this idea to provide post-session feedback forms and issue attendance certificates to enhance more active participation and engagement in the webinars and forums. So we know people like certificates. And we'll try also to compile a comprehensive list of pediatric cancer hospitals with a particular focus on those in LMIC countries, and send outreach letters to these institutions, highlighting the opportunities available through SIOP Psychosocial Wellbeing Working Group for engaging more psychosocial professionals from LMIC in our initiatives. Yeah. So thank you for attention. If there are any questions, I will take them.
Yeah, thank you so much, Elisa, for enlightening us on the activities of the working group. This is all like very active. It's again reactivation of this working group, because this was a little bit dormant in last year or so. Yeah, Michael highlighted it's a good number of WhatsApp members. So this is really exciting. So I just wonder, you have these two webinars. So did you find the number of attendees? Was it a good participation?
So in two webinars, we had around more or less 60 registered participants. However, attended around 30 people. So this is not very good. So that's why we had this idea of providing after webinar survey and certificates. So we had this idea that maybe this can motivate people to attend.
Right. Even if it's 60 registrations and 30 participants, this is a good turnout, I believe.
Yeah.
50% people joining, because usually, as Adelia told us, 74 registrations, and we just found like up till maybe 30 participants in today's meeting. So anyhow, this is good going, and congratulations for what you're doing. I just have a suggestion that one thing which I noted in presentation by Mirai about inviting Shazadi Resham, who's just stepping out, the leader, the former co-chair of the working group. So maybe if you can also try to engage the the 2 or 3 last co-chairs, particularly I see Nicole was very active in last 4 or 5 years, and Nuria, and they managed to publish a good paper also on psychosocial aspects in LMICs. So maybe those they could be the potential speakers for presenting whatever they have find out or something relevant. So it's
Yeah,
good
sure.
that we are doing in GHN level also to engage our former leaders in the activities of GHN. So the working groups can also devise something similar to just try the momentum continued with the engagement of the former leaders.
Sure. Great idea. Sure. Thanks.
Well,
Michael, you had raised hand, then Regin. Michael, you
It's my question is to you and to Rajan, actually, is with these meetings and people like certificates, where are we at with formal CME recognition? So that another incentive for people to get the certificate to say you've earned so many points.
well, Michael, we have discussed this in one of our senior meetings, whether to give any certificates, because, the Congress is there is certification in the Congress, the CME and certification. This needs some effort, some funding as well, because having a certification needs some funding. And we have also discussed whether, well, some people want the certification for their work, the CME certification, or some people only want a certification saying that they have attended, which is enough. So because the CME certification needs extra funding and we have to have some sources as SIOP. But the other needs a little secretarial work. And in fact, I had told them that there is such a program, in fact, when you have your email and your country or your site, that the certificates can be initiated. So we are looking at it. The second thing, for example, in the Istanbul University preventive oncology seminar series that I have been doing since December 2020, we first gave certificates, and then the rector said we don't need to give certificates. And now we are not giving. What we see that if we have a good topic and a good speaker, the number of attendees are the same. So certification may increase, of course, the number of attendees, but it is usually the topic and the speaker that makes it, and also the announcing through the SIOP weekly bulletin, announcing through our, we have our WhatsApp groups, our professional WhatsApp groups. I think the social media, I'm not a very good user of the social media, I shall admit, but the social media, the WhatsApp groups are really attracting many, or at least disseminating the knowledge, because many people are have such a busy schedule and they forget that there is a webinar starting. But at that time, when they get from the WhatsApp, the webinar is starting, or they say, let's go to the webinar. I think at least our members are using the social media more and more, and the SIOP Connect is doing a lot of things in that regard. I think both the Global Health Network leaders and the SIOP Young SIOP group is really active in it. So when we have the webinars, they are announcing it to their members, and I think especially in the previous years, we have had a lot of young SIOP members also attend these webinars, which is really good because we want to attract more of them. Yeah, but for the certification, as I say, the CME certification maybe will not be done for these kind of working group seminars, but maybe we can do the certifications which are not CME, just attended the webinar. We're trying.
Yeah, we were thinking about just a certificate of attendance without any CME thing.
Yeah.
And that needs this CME needs a lot of work, because we have done for CEDAR webinars, you remember. So it was a lot of effort needed for applying, and then funding, as Regin said. So it's not that easy task to do. And you need a good number of participants also, for investing some amount of money for getting the CME accreditation. But I don't know, this certification or CME certification that probably different categories, probably nurses might need it more than some other categories. I'm not sure, but yeah, another thing which I just thought of, and we were discussing since the launch of this working group in, I think, 2017, when Nuria took over, was to engage the nurses. So maybe it could be a good, because LMICs in the low resource settings, nurses are doing everything, including the psychosocial care. So if we can coordinate with the nursing network or the care working group within the nursing network to engage with the activities of this working group, probably that will be very good.
Maybe do a joint seminar. And
Yeah.
Alyssa, can I ask you, Alyssa Nayoshi, can I ask you, are you having any interaction, any collaboration with the psychosocial network?
With Psycho-Oncology Network, you mean? Yeah.
Yeah.
Yeah,
Because
yeah,
that's what we want. We want a collaboration. That's good. And also the previous, I was on the phone and I could not open my, I could not unmute. So also congratulations for Ahmed that presented previously. For the integrative oncology in the educational day, there is a joint session of the nursing network and the supportive care network in the afternoon. That's the first session of the afternoon in integrative oncology. Just because in this session, as Ahmed said, there will be a keynote lecture on also integrative oncology or complementary oncology also. So the ones that are interested, just please note that there will be one. I'm one of the speakers, so I'm promoting it. Yeah.
Yeah. Thank you, Rajan. Michael, you have some other comment?
Oh,
Or it's all?
I've always got too much to say on these meetings. No, you could have an automated download. If you've joined the meeting, at the end of the meeting, you get a code. You go back in, you log in, gives you a certificate. Yeah.
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 You don't
Yeah,
get the
because-
code,
yeah.
it's attended. Yeah.
Because that will also, because we don't want too much secretarial work because they have a
Yeah.
lot of work.
No.
So we're trying to work on that. Yeah, Michael, that's really brilliant. Yeah.
Right. So Ayushi is around because she said that she wanna add something on it. Is she around?
She had problems with
Okay.
connection, so maybe,
Okay.
yeah.
Okay. Okay. Right. Thank you so much, Elisa and Ayushi, both of you. It's really great work, and we look forward to a very active engagement in the next year also. Thanks so much.
Thank you. Thank you.
Then Research and Innovation Working Group. So Caitlin is not around. Venki, you can present. Venki is with us today because Caitlin, I think, is not also. I don't see him. Maybe if he joins in between, then we will ask him to present maybe in the course of the meeting. So this is also a very active working group with very active WhatsApp and good communications. So they did a very nice session last year in Ottawa, and they are doing this giant session, which we have shared earlier also, and 355 members in the WhatsApp group. So it's I think this is the biggest one within the working groups in GHN. So anyhow, so we'll like to learn more. And I think they have a recent webinar with the palliative care working group collaboration. LMIC mentorship program and session in 2025. So one thing which we noted down, we will discuss with Venki and Caitlin, because they were not there to engage the scholarship recipients in whatever way within the GHN after the scholarship receiving the scholarships. Okay. So let me ask the partnership working group. Would it be Caesar or Nita?
Yes,
Yeah, Caesar, please go ahead.
yes. Thank you, Sagir, and thank you for the good meeting and good organization has been wonderful. Next, please. I would like to mention that Nita is leading this year. Nita Radhakrishnan, tremendous amount of job, terrific job what she's doing. So I think that we have to recognize that one.
Since your voice is little soft, so can you just talk closer to the microphone?
What about now? Better?
Yeah, it's better now. Yeah.
Okay, perfect. One of the things that we have done is to try to do different things, and I'm going to pass quickly here different activities, diversity in disciplines. But one of the things that we have to keep in mind is that part of the component of what we have done is to redesign the partnership working groups, not only the meeting, but the overall thing. So I would like to pass quickly for this. Next, please. We have done 2 different educational sessions, and I would like for you to see the different content that we are trying to do. We did one with Dr. Federico Antillon from Guatemala. Now he's the current co-chair of the Global Health Network. And we did another one with Dr. Samita Mahajan and Dr. Chika Krishna from India. That's in education. In terms of the research, there have been a fair amount of activity doing with different members. And I have to acknowledge the amount of work that has been done with Nita, with Regine Kebudi, with Teslop, and with Guillermo to redesign and the concept of the group. We did a SWOT analysis before, and sorry, it's too much to present, but at the end of the day, the idea was to try to review the group, what are the concepts, where we are going to move forward, and that will help us for the next several years. In terms of advocacy, was understanding the national associations, and here, please go for the next one. Here is one of the seminars that we did with Dr. Antillon, the presentation about the pediatric oncology in Guatemala and Central America, past, present, and future, was an excellent presentation. One of the problems that we noticed in that presentation is that despite of the advertisement, there was not too many individuals that they were present in this. And I know that this is one of the issues. Many people register, but at the end of the day, they don't attend. We try to engage in a different way. Next, please. For the next seminar, that was the association. And one of the major concepts that the partnership group is working is what are the elements that we are going to engage. And what has been decided is that the partnerships we are going to engage are the pediatric hematology and oncology associations for the different countries, because that will allow to bring a new set of individuals and partners that in this moment they are not covered for SIOP. I think that their partnership has been in SIOP as a key element, and there have been a myriad of different partnerships that have been there, nurturing the concept of SIOP, but there was the need to do it in a different way. And with this studying group, we work, and I think that Reggie, who is here, almost on a weekly basis for several months in order to get the ideas, to move, to refresh, to change, to modify. And it was a tremendous engagement from the team. So that is one of the new visions that we have for the group. And I would like to get this information because the next one, they gave us a little bit of idea about what happened with this meeting. Next, please. And thanks to Tessie, we were able to get some information. Here we have 161 individuals registered just for the meeting. There were 70% attendance, 118 attendees, and we were able to get some discrimination about the attendees, 21 physicians, the 46 SIOP members. And one of the things interesting is 19% they were from the young SIOP. I think that this is something that is interesting, the young SIOP group. And we try to engage the different groups as well here, because they have to have this level of attention, and they need to have these interactions. There were 16 individuals present from different disciplines. There were 73 that they were not members, and actually one of the things that was important for us, and one of the things that we have been discussing, is that our partnership group has to try to engage more membership. So we are stimulating the membership to SIOP overall. So we have these meetings, and we will continue to do it, and using the structure of the different continents. I think that they're going to help. We have been in communication already with the continental branch. And also we are working in the line services regarding specific topics that we would like to engage, and we would like for the other partners to let us know we would like this topic and we will address this situation. Next. So as I mentioned to you, one of the major themes that we were engaging is to redesign the group. With the steering group, there was a new tour, and the purpose was to assist SIOP leadership, continental branch, global health network, co-chairs, etc., identify, evaluate the possibilities to join, work, and develop a strategic relationship and collaboration. And I would like to emphasize the strategic relationship and collaborations, which is a different concept of just to do. I would like to work with you in this. I think that where the line of services they are going to be important. The aim is to foster collaboration with this group to share research achievements and findings and/or recent developments in childhood cancer and advocacy group. And this is important because when we change the concept with the group on India, there were specific presentations about the development of the Hodgkin program and protocols, as well as the development and the results from the acute lymphoblastic leukemia protocols in India, which made a little difference. So that's part of the objective that we have as well, is that we would like to give the pathway for these partners to be able to present in a different way and to get a little more global engagement, if you wish, and global knowledge of what they are doing. I think that sometimes in the meeting they are not easy to do it for obvious reasons. It's a lot of people there, but I think that this stimulates, and that is our goal, the different international partners to present their job. And I think that this particular meeting demonstrate that it's feasible to do it. Are we going to maintain it? That's what we are trying to do. And I think that the overall concept is definitely, we had a tremendous audience, as Regine mentioned. We need to engage. And one of the things that is interesting is that, and I would like to emphasize this, the registration is one thing. How many members are in a specific group is another thing. But at the end of the day, how many people are doing the work? That is a completely different scenario. There is a completely space between one to the other. And what we would like to engage is the members to participate as much as they can. It could be a little, it could be a lot of, it doesn't matter, but at least that they feel that they are doing something for the group, that they feel that they are part of SIOP, that they feel that they can do something for the future of the discipline. And I think that this is an engagement that we would like to emphasize in the partnership group. Next. So at the end of the day, the path was ahead. I think that we presented last year some of these. One of the things that was the refinement in the third discussion with the SIOP leadership is already accomplished. SIOP Connect to improve engagement with the members. I think that we need to work a little more into that because we have been a little slow into this process. Part of the reason is in the past, one of our meetings was didn't work very well. Some people that they were not associated with SIOP connected there, and I think that we have been a little more careful in how we promote these things. But I think that after that, SIOP Connect has been definitely a way to help us to make sure that we have this level of connectivity safety, if you wish, at a particular moment. Obviously, working with the continental branch meetings, internal briefing, that's what we are doing, and promote the interaction with other societies, which is what we are doing at this particular moment. And that meeting was in association, and NITA was able to get the association with the Indian Society of Pediatrics. And I think that that's another way to see this element. And I think that I have taken a little more of the time for the group, but I appreciate all the efforts that everybody is doing. At the end of the day, we have to acknowledge as well Sagir and Federico input into all these things to make sure that the partnership group has a new vision. We would like to make sure that the individuals that participate, they are really engaged and they want to do things. Like they want to move the field. That's the overall thing that we would like to do. And we have different line of service to do that. So I encourage all of you to continue helping us here and help SIOP at the end of the day. Thank you.
Thank you so much, Cesar. Thank you, Nita. Actually, this was a long but very thoughtful process to refine the terms of reference and launch this very good activity with India Spotlight session with such a wonderful participation and a very nice session altogether. And it's available on YouTube, and I think there will be a lot of views after it's uploaded there. Yeah, Regin has a question. Regin?
Yeah, I would like to comment. I'd like to congratulate Cesar and Nita for the hard work. And, you know, year-long, we have had quite Zoom meetings and quite email traffic with Guillermo Chantada, our president, me as the Secretary General, you as the co-chairs of the Global Health Network, and Cesar and Nita as the co-chairs of the partnership group, how the partnership group should go on, what to do, what the scope should be, and then the terms of reference was done. And this India, the first, I had suggested that why don't we involve the national groups so that they are more involved. We have so many national groups, but low participation in SIOP, and whether to make SIOP more visible within their group as well. So this one was the first one that was done, and I think it was quite successful thanks to Nita and Cesar, and also the QA and the discussions, thanks to Cesar, was very, very active. There were a lot of questions, right, Cesar?
Yes.
In fact, it was over the time that was allocated to it. And I think it worked well. And maybe we could promote that. Of course, we want as in this case, it was the presentations of the multi-center groups, because we would like, if we have a national group presenting, then we would like to have more multi-center group as was presented, so that we want to know more about that that national pediatric hematology oncology group and how we can engage them. That's why it was also open not to members, also to non-members, to also engage the non-members so that they see them. And we will see whether there are more participation. And in fact, we gave 25% discount for members that were in that session and would like to come to Honolulu. This was advertised, I think. I don't know if there were any that will come in with a discount, but that was very good. And I think I saw Julia's here. I was on the phone, now I am on the laptop, so I can see the people more. And I would like to thank Julia, our past Secretary General, a lot, because she, in her time with the Kathy's together, started to make these terms of reference, which is really very good. The terms of reference, having more people involved, all the elections, how they will go, how many terms one person can do, the non-Congress activities, everything, which we also try to follow and complete. So I think this is very good for all our members and all our leadership. Thank you.
Regina, I would like to echo what you say about Julia, because at the end of the day, with Julia Chalino, some of you they are not aware, but that was the way that we started to think about how we redesign. And with Julia, there were many coffee table meetings to discuss about this. And definitely, thank you, Julia. And I hope so, Julia, that you can see now what we started a few years ago, how it's evolving. So I hope so that this will be something that reflects how you help us and how you collaborate with us and with the Global Health Network to make sure that in association with our leaders, these ideas, they were able to be moved. And I hope so that we are moving in the right direction.
And Sagir, maybe you saw in the chat, Rula has written for the CCI. Of course, we have to always engage CCI also in some of these webinars. They can also take a lot of role. And thanks to Julia again.
Yeah, for sure. Yeah, thank you, Cesar, and of course, thank you, Julia, for whatever you did and whatever you are doing right now also for GHN in terms of guidance and advice. And yeah, I note Rola's point. Yeah, we had a group actually earlier, working group, which was based on CCI, but we have to disband it because of no activities. But of course, we are very happy to include CCI within our working group activities. They are always welcome to contribute. And thank you for joining, Rola, today's meeting. Cesar, I have a question. It's really, it's not really fascinating that 119 members in a session. But I think it was on the India, and hopefully we would have the similar number of participants in the future. Did you see how many of them were from India itself, or and outside India also? Because I know India, it's a very organized a pediatric oncology group within the India. So did you find the numbers outside the India who participated in the meeting?
That is a very good question, Sagir.
Let me answer that, Sagir, because I anticipate we're following that because we want to see, because the partnership group and how this would go was discussed for a long time. So we were very keen on following it. And almost there were almost 1/3 to maybe a little more than 1/3 that were not from India. So it was other countries as well. So that was good. So this is something that, because we were discussing whether any other member would like to listen for a specific country or not, because we want more members to be engaged. And there were almost more than 1/3 of the participants were out of India. Yeah.
Yeah, that's even good. Yeah. So hopefully we would have the Indian participants, more Indian participants in the next meetings also. Yeah. So we would have good numbers in the future even. And maybe the non-members you pointed out, we might have to dig out at from where they are. If they are from India or wherever, maybe we can just try to get them engaged within this working group and other working group activities also. So anyhow, thank you so much for leading from the front, and welcome on board on CST also, Cesar, for this 1 year, term.
Great. Thank you, Sagir. I appreciate it. Thank you.
Then this is the last working group. Bilal and Choki. Bilal, you are presenting the PROS working group.
Yeah. Hello. I hope everyone is fine, and can you confirm that you hear me well?
Yes, of course. Please go ahead.
Okay. So this was the number around 240 in June, and now the membership is more than 260 right now. But not all of them are radiation oncologists, but we do not have the exact number that how many of these our members are actually radiation oncologists. We do see through our membership data the distribution from different countries, fellows or full-time consultant or type of healthcare professional, but among the physicians, I believe we do not have a way to identify the number of radiation oncologists among the cross working group members. So I think that's a challenge that we really need to look into it. Probably Natia in previous years and Mark Gaze recently talked about it. So and I had some conversation and exchange of emails Tessie earlier this year. So maybe find a way to do that. In order to engage these people, we have been having a lot of different activities. The one thing which is actually not included in this slide, I just missed that single slide, was that we recently had a pros meeting in Congress end of June 2024, where we had scholarships given to around 12 people, and there were many from the LMIC, which were combinedly funded by TBA International with a grant of $6,000 in all, and some donations from one of the senior anonymous PROS members. So during the PROS meeting, we highlighted various activities. I presented about the opportunities within SIOP Global Health Network, and SIOP Connect to engage more people, and had a meeting with those members from LMIC, as well as myself, Mark Gaze, Nathia, and Janet met Lisbeth Cordero, who is from IAEA, for collaboration and our work that's ongoing during with IAEA and to support WHO GICC. Among all the things, I would particularly like to mention about the pediatric radiotherapy guideline. It's overdue now. The book by IAEA, currently with International Atomic Energy Agency's publication division, and hopefully it would be out soon by the end of this year or maybe next year. There have been efforts going on, started or almost completed Hodgkin's disease, and now working on medulloblastoma to produce educational content for radiotherapy planning and treatment delivery for pediatric tumor. Natia is usually leading that. Uh, the publication for the IAEA data collected for Lancet Oncology Commission survey for pediatric radiotherapy services is being led by Daniel Indelicato and Ray Mayhor, and Janet Park and Dr. Joki, my fellow co-chair for this working group, have been working on that. So there have been publications and some abstracts presented both at the PROS meeting, and some of them will be presented from LMIC Radiation Oncology at the SIOP meeting and other regional meeting. We recently published a paper on uh, uh, radiotherapy utilization rate on neuroblastoma by one of the colleagues from IAEA. Dr. Azumi is published in Green Journal, and we had the twinning experience between Emory University and Ethiopia to support radiation oncology for children in Ethiopia, recently published in Journal of Global Oncology. So trying to spread the word and uh, trying to participate and bring up pediatric radiation oncology content in different regional and continental meetings include pediatric radiation therapy workshop and lectures at the MISTRO meeting in Riyadh previous year, and the upcoming meeting in November, Pakistan Society of Neuro-Oncology meeting last year, where yourself, Dr. Saveer, and Rajan was there. There was a pediatric radiation oncology brainstorming and practical applications workshop for Europe and Central Africa, where a number of cross members, including Natia, Janet, and Lepre, Yavuz led that. And I would particularly like to mention about the educational contents being done locally by Mehak Hospital. Mitra has been on this call. There was a neurong meeting in May and recently on head and neck sarcomas. Janet and Joki participated and brought up pediatric content for the SIOP Africa uh, in June, as well as a Sonoza meeting in Zimbabwe, and so did Edidio Joseph in Nigeria for the local workshop. So just trying to collaborate with WHO, IAEA, St. Jude. We all know about the lecture series, which has been very well attended recently. This is a collaboration between Cross Working Group, Pediatric Radiation Oncology Society, supported by Dr. Beate Timmermann as West Germany Proton Essen. We have had 2 lectures up till now. One was in July on general principles of pediatric radiotherapy by Dr. Beate. I think there were around 150 participants maximum, with more registration. Maybe Anelia can tell about the total registration. And last week we had a lecture by Dr. Akmal Safwat, who has origin from Egypt, now working in Denmark at the Proton Center, talked about the bone sarcomas, which was also well attended. Both the sessions went beyond the scheduled time of 1 hour with more than 40 minutes of question and answer and interactive discussion. So we are trying to build up collaboration and come up with workshops for the regional meeting like Maestro, Poem, and trying to get into other continental SIO meeting with radiation oncology content a bit more. PROS colleagues have been deliberating a lot on Latin American countries, the South American countries, how we could break the barrier about language and collaborate over there. So talking about the next scheduled activities or upcoming projects, Dr. Sarir, if you can move to the next slide. So I already talked about building up collaboration in Maestro and Poem and SIOP Asian region for their conferences next year. And the upcoming Maestro meeting in 2024, there will be a neuro-oncology symposium at our institute, which is globally well attended, being hybrid with international speakers as well, looking at the advancement of standard treatment and management for pediatric tumors, supporting the radiotherapy part of it. The pediatric radiotherapy lecture series is continuing. It will continue through the year 2025 at the scheduled calendar. We plan to, with leadership of Natia, expand EduMode for other diseases, and it does involve not only experts from Europe and North America, but also LMIC representatives to identify the challenge and the learning needs for different resource settings. Natia also wants and is working on building up a mentoring and program and peer support program for pediatric radiation oncologists in LMIC and different resource limited setting. And Pentec group is going on with publications about the late effects of radiation therapy, and now there is an opportunity to support young investigators in radiation oncology from resource limited settings or globally who want to build up a career in pediatric radiotherapy. So academic support to look at the late outcome endpoints of radiotherapy. That's for Sandy Constein, and maybe at SIOP meeting, we'll be talking more about it. So thank you. Sorry for being a bit long.
Thank you so much, Bilal. This is really exciting, the things you're doing and the plans for the next year. So Anelia just wrote it's 120 participants in the last webinar on sarcomas, bone sarcomas. Congratulations, that's a great number. So I'm just wondering, you have like 240 odd members. So do you have any idea that how many of them are active in, various activities you are designing in terms of webinars and insight meetings or the lectures?
Dr. Sagi, I still struggle to match those numbers because this is kind of I don't know how to do that analysis. We have there's a list somewhere of the attendees, and there's a list of members who are the SIOP. I can only recognize those names by name if they are radiation oncologists or not, because we don't see the specialities of the group members.
Right.
It's one way, it's very encouraging to know that a lot of young fellows, pediatric oncology fellows and pediatric oncologists are members of this working group to support the cause and support the advancements of pediatric radiotherapy and emphasizes needs. But at the same time, it remains a limitation on how to
Yeah.
engage whom. Like there may be some core things that would be of interest only for the radiation oncologist. So we need to talk more about it. And
Right. I think I really wonder that 120 participants in the meeting, they will be, I don't know, maybe how much you expect that they are radiation oncologists. So there must be a lot of pediatric oncology folks
yeah,
attending the
yeah,
meetings. So because we
I
don't
do,
have so many radiation oncology service
yeah,
providers. Yeah.
I do see, because those people are the question that were coming up seem to be like more from a radiation oncologist. So the event was advertised through different forums through different radiation oncologists, through the PROS website as well. So I believe there is a lot of participation from non-SIOP members as well in those lectures.
Maybe in the next lectures, I don't know, is there any possible way to capture the special, specialities of the people, if there is a like short survey or something in the end, or I don't know. If there is any possibility, we can discuss with Anelia and Tessie if there is any such possibility. But that's really interesting that these webinars are very well met. And also, I'm just wondering for the other working groups also, the lectures which are posted on the YouTube, we can just keep a track how many views and how many likes and shares. So that will also be providing us some, indirect impact of our efforts, something like that. Anyhow, thank you so much, Bilal, for sharing and all those great efforts you're doing. I saw Michael's hand raised. Yeah, Michael.
Can I make a comment?
Yeah.
Bilal has not mentioned ARIA and his amazing work on ARIA at all. And ARIA is a key partner of ARIA is PROS, but also what I don't want to have forgotten is that ARIA is a partnership between SIOP and all of the other partners led by SIOP, and that the Global Health Network for PROS is a member of ARIA. And what I'd want to make sure is that ARIA is not forgotten of the SIOP Global Health Network, because it is a crucial partner of it. So I think it's really important, Bilal, that you update your slide and give yourself some credit for the phenomenal work you've been doing. It's remarkable.
Congratulations, Bilal.
Michael, I intentionally did not include slide about ARIA because it adds one more slide, and I know that you would be talking about it. And
but make sure we want the message out there.
Yeah, definitely.
You and Karen are doing phenomenal work.
Yeah.
But what I'd like to see is that ARIA has a logo in the SIOP Global Health Network slides. Every slide should have ARIA there, because it is such a collaboration.
Yeah.
Otherwise, it's because what I don't want is, and this is the thing, is this is not a St. Jude project. It is a Global Health Network, SIOP and partner project. So it's very crucial.
Yeah, so there's so
Yeah.
much more, Dr. Saeed and Michael, that's not over there on the slide. It includes ARIA, it includes
Yeah,
the radiation oncology presentation
I'm
on
sort
ARIA.
of pulling your leg, but you've also undersold
I don't
yourself.
I won't
There
miss
was
that again. Yeah, sure.
Yeah. Anyhow, congratulations, Bilal,
amazing
for
amount.
all your efforts and work
It's
for
amazing.
SIOP, GHN, PROS, and ARIA. So I think this
Phenomenal.
strategy for membership engagement we have discussed during the working group slides, but I think I must emphasize the great work ongoing. I congratulate all the working group leaders and the members who are engaged. But probably one thing which we can do, I will suggest to the all leaders, if they can just put like a tentative 1-year calendar for the activities of their working groups, and we can just assemble them and put it over SIOP Connect or wherever. So just to reflect that what we are going to plan. So that will be a great exercise if you can just plan. You put like a 1-pager of activities in the next year, which are in the form of webinars. And also interaction within the working groups, wherever it's already done, it's wonderful, but we can just augment it further and try to get more connections within the working groups to plan. If there are any questions or comments before we go to the next item. Okay, thank you so much all for presenting, all the working group leaders for your efforts and presenting here. Before we go to discipline, I will ask Michael to share the ARIA, and then we will go to the last and the most important strategic point. This is which you are evolving into. So, Michael, floor is yours for a brief update on the ARIA. And you know, ARIA is one of the evolution from the ATRs, the SIOP PODC adapted treatment regimen. So we own this from GHN context. Yeah, please go ahead.
Can you make me a presenter?
Anelia?
Anelia? I hope, can we?
Yes, I think you can share now.
Thank you.
Welcome.
Can you see my slides?
Yes.
I'll just make sure that the slides are going forward, because sometimes that doesn't happen. And it's happened to me so many times.
Excuse me, Michael, you're not in presentation view. We can see your little outline.
Sorry, I am in mine. Yes, mine is in. I was just saying this happens to me nearly every time I do a presentation, and it doesn't go into the right mode. So I can see it now. So I'm in presenter mode now.
No, but it's pretty big. It's legible. It's good.
Can you see my slides? And are they?
Yes.
Yeah.
Yes.
Okay, cool. Got it. All right. So I'm gonna run through this pretty quickly. But it's to give everybody an update on where ARIA is, and as Sahir mentioned, ARIA grew out of the Adapted Treatment Regimen Working Group. It's a collaboration between SIOP as executive sponsor, together with St. Jude, who is the other executive sponsor, and St. Jude pay all the bills. So we are enormously grateful for their support. PROS, IPSO, and CCI. The goal or the vision is to improve the treatment of children and young people with cancer wherever they live. And we've adopted the SIOP byline. And the mission is to provide trusted, safe, effective treatment for children with cancer in all resource settings, to develop the best evidence-based, and that's a term I've made up, the best evidence-based guidelines for the diagnosis and treatment and supportive care of children with cancer, made freely available on a web-based portal to health care providers everywhere. So that's the mission. This is just to recap on the timeline for the project, which really kicked off when Nikhil Bhakhtar and I met in 2018 at the GICC meeting, followed by subsequent meetings during 2019, and then over the period of COVID through to 2024, we've now really built this collaboration and some key drivers, Carlos Rodriguez Galindo and Kathy Pritchard-Jones, but with the tremendous support of Jeanette Parks and of course Julia, who's on the call. This is a slide that's
Sorry, Michael, you are not moving your slides. We just
I
see the
am.
title slide. Yeah, if you make it as a presenter
Can
mode,
you,
then it
yes, I'd hope you would have. Yeah, sorry. This is enormously frustrating for me. It happens so often. I'm going to go back and try again and see if I'm going to go to here and switch. Can you see it now? Can you see my presentation?
Yes,
perfect.
yeah, that's perfect.
Are
now.
you
Yeah.
seeing the slides going forward and backwards?
Yes, now I can see.
Okay.
Please go ahead.
Right. This happens. I don't know what it is, but I usually have to spend a few minutes making sure my slides are going. Are they going now? Can you see the next slide, which is the...
Yes, indeed. Yeah. Now it's working.
Okay, cool. So that we've got a steering committee, and these are some of the this is the membership of the steering committee. This is in transition, and Julia providing enormous support, and Ira Dunkel has taken over the SIOP role. Nikhil Bacter and I and me are co-directors. Hafiz has a role as IPSO surgical representative, and Bilal pros and are members of the core team. We've divided up the leadership into a number of work streams now, with Nikhil, Monica Key, who's the program lead, fully funded by St. Jude, and me as the other co-director. And we've got a disease-specific program, supportive care program, surgery program, radiotherapy, palliative care, survivorship, nursing, and implementation. And you can see that many of the faces on here are members of SIOP Global Health Network. This is a very old slide, but it just shows the process that we're working at when it comes to, for instance, a specific disease. The process is to seek global nominations to form global representative groups and a working group. And the way we work is to have a working group with a global representative panel and technical expertise to develop an adapted management guideline publication and enable it on the portal. These are a list of some of the leads who are leading diseases and non-disease areas. And many of them names you'll know are leaders in their own areas. This is a snapshot. One of the most important metrics is up at the top here, is the number of contributors and collaborators. We now have over 700 healthcare professionals, on global representative panels within working groups across the 14 diseases we're working on, palliative care, surgery, radiotherapy, survivorship, and supportive care. In addition to the disease-specific guidelines, we're also developing the portal, and the portal will have a number of additional tools in it. Carebook and care tools. Care tools is tools for staging. Carebook is a drug pharmacopoeia, but also supportive care guidelines like tumor lysis syndrome, febrile neutropenia, etc. So each of these components are being developed. We've spent a lot of time, and this last 12 months, we've worked very hard to define the methodology, because one of the criticisms that we have, and this has come up quite frequently, is how can you make this recommendation and the guideline because you haven't got the evidence? The evidence in your setting and your stratum, because we use a stratum-based approach, not an evidence level approach, nor do we use a resource level approach. We use a stratum approach. And so that we've done a tremendous amount of work now on identifying the processes and the methodology for the development of trusted, effective guidelines for children with cancer in all settings, low income, middle income, upper middle income, and fully resourced settings. So stratum A, B, C, and D. So stratum D is a fully resourced setting like I work in and like many other people work in. Stratum C may be in many places, for instance, in Malaysia or Central America, South America. Stratum B is a startup or a basic center, for instance, in Papua New Guinea. So we've developed this approach. And the key concepts that we've had are you have to identify the content, you have to adapt it to the context, you have to have a process of implementation, it has to be acceptable, and it has to be trusted. And this is what we're working on: disease-based guidelines, supportive care guidelines, palliative care, radiotherapy, surgery, and survivorship. The first process is we identify the content. That is by literature searching, etc. Develop a working group and subgroups that are appropriate. Try and find the best evidence in all settings, but particularly from low and middle income settings. Look at the process of adapting the information to contexts using a structured approach. Look at how we might implement a guideline, and that is the implementation tools, particularly the portal. And adaptive management guides. Is the guideline acceptable? And this is about peer review. It's about involvement of stakeholders, CCI, parents, groups, the WHO, and other collaborative groups having a look. And then is it trusted? Because people are not going to use something that's not trusted. So that is about having good governance, having conflict of interest dealt, having implementation science, and a trusted methodology. And this is where we're at the moment. For instance, just on the disease guidelines, working backwards from the green, we've completed Hodgkin's lymphoma. We're at the final stage of low-grade glioma, retinoblastoma, and neuroblastoma. We're in the review phase for osteosarcoma, medulloblastoma, Wilms tumor. There are 98 people involved in the Wilms tumor global representative panel on the list, and we're going to be having a call out after SIOP to form the Wilms tumor global representative panel. Drafting rhabdomyosarcoma, hepatoblastoma, Burkitt lymphoma. Acute lymphoblastic leukemia, I think it's had 29 meetings. And then finally, this is at SIOP. This is one of our SIOP abstracts. I think we've got about 8 or 9 abstracts at SIOP for ARIA this year. And this is just one that describes the overall program. So just to remind everybody that this is open to any member of SIOP to get involved in any area, and you can see that we have across the breadth, there is a huge opportunity for young investigators, old investigators, not so old investigators, surgeons, radiation oncologists, nursing, etc. So it is my other full-time job. So thanks for the opportunity.
Thank you so much, Michael, for updating us. It's a great progress, and I hope it will be, everyone is waiting for its real launch, and we will listen something during not me, because I will be just listening the recorded lectures. But those who are attending, they will be listening to you about further progress in various sessions I highlighted on ARIA and also in our GHN Education Day. Thank you so much for updating us on this great work.
Great, thanks.
So if there are any questions on ARIA, before we go to the last item of the day. Okay, let me quickly go through this. That is something which we are going to launch as we discuss in the GHN SWOT analysis. So we found the disease-specific education. It's as one very area of interest by the participants. within the SWOT analysis and access to the treatment protocols, which Arya is doing. Michael is leading on that. And then we did a survey during SIOP CEDAR sessions last year when we concluded, rather in between after the sessions. So we found out these areas where the people are asked for the more sessions on, and you see the solid tumors at the top, then hematologic malignancies, treatment guidance, palliative care. You can see the boldness of these in Silido. And if you break down, the people were asking for more education on neuroblastoma, Wilms, bone tumors, brain tumors, ALL, AML, CML, and so on and so forth. So based on what we have in these two surveys, and considering that SIOP is the only global society with focus on all resource settings, with more than 3,000, rather subdated like more than 350, 3,500 members, and considering high demands for disease-specific dedicated learning initiatives and practical guidance, particularly for the care providers in low resource settings. And also, we know that SIOP members have enormous experience and expertise. There are a lot of disease experts within SIOP leadership right now, and the previous leaders, and many more who are not in the leadership status. So there is quite a possibility to generate something within SIOP which is not existing right now, to deliver some dedicated guidance and education and learning opportunities for the SIOP members, especially SIOP GHN members. You know, the GHN catering for low resource settings where this is a big issue to get some specific guidance on tumors. And in the last quarterly meeting, we discussed about various initiatives which have been evolved over time at different levels, like Global Neuroblastoma Network, like neuro-oncology initiatives in various regions like Pakistan, Jordan, Sikh kids derived initiatives, some initiatives on retinoblastoma and other diseases. So there is a lot room and potential to provide such like avenues for learning and networking for SIOP GHN members, SIOP members. So regional and individual groups exist, as I said, and there has been a study on impact of these forums or the portals in various publications also. We are proposing a disease-specific learning and networking portal that will enhance not only the membership engagement, but also that will improve the professional nurturing of the GHN members, the folks from the low resource settings. So this is what we name it as Disease-Specific Portal for Learning and Networking. The acronym is DISPLAN. It will be a GHN focus activity with the scope of, but we have already a scope of GHN to foster the unmet needs of the professionals working in low resource settings. So learning avenues for pediatric cancer directed, but not limited to WHO index cancers. That is what we want to do under this forum. That will provide learning on various aspects of common curable cancers, including the case-based discussion forums, something about diagnosis and referral pathways and access to care on common curable cancers, and advanced diagnostics and therapeutic modalities. And possibly in the future, it might provide some avenue for research collaborations also on disease, on different tumor types. So what we propose after some discussion within ourselves, I have a discussion with Federico several times, Guillermo, Julia Chelinor, and Noreen Mushtaq, and also today with Regin Kibudi. So we would have a first pilot phase of 6 months starting from November 2024. This is the proposal. Hopefully we will get it through. So it will be 6 months starting from November till April next year. The basic intent is to globalize the already existing smaller and regional groups on disease-specific learning. For instance, Pakistan Pediatric Neuro-Oncology Forum, which is it's not a national, rather it's a regional and international forum delivering a lot of education on brain tumors in terms of lectures from the experts on disease from various parts of the world, and also some tumor board sort of discussions. And some other forums also. It's only an example, because I have a discussion with Noreen Mushtaq. She's leading that initiative, and probably that will be the low-hanging fruit to just use the resources or logistics which are already there to just kick off this pilot phase of this plan. And that will be the virtual sessions conducted using the existing resources. We would need the assistance of SIOP Secretariat for promotion and dissemination of these sessions. And this plan will coordinate education day sessions during SIOP Asia 2025 Congress to be held in Riyadh, Saudi Arabia in April 2025. I'm a part of the scientific committee, by the way, of this SIOP Asia Congress, and we have, from our end, we have agreed to do Education Day, 2 tracks, simultaneous tracks on this plan by the experts on Education Day, which will be 12th of April. So in addition to the virtual sessions, we would have an opportunity to have in-person kickoff also. And as I already pointed out, we are having a session on Education Day on 17th of October during Honolulu. Our GHN Education Day, that session is titled, this is session number 4, titled Disease-Specific Learning and Networking. So basically that is providing a context of what we are going to do in this plan project, forthcoming this plan project. We would have the panel discussion towards the end, in addition to Noreen Mushtaq, Trin Israel, and Jesse Barry as a presenters. We will have Scott Howard, who is leading RCAN. This is ALL Research and Care session portal, which they are providing a very, very active and effective education on leukemias. Then we would have Catherine Matteo, who is the lead of Global Neuroblastoma Network, and Federico for the panel discussion. So we would be discussing more about this plan, and Gabby will provide, who's one of the moderators, she will provide a brief input about how this plan will look like in that very session. So at the end of the pilot phase, the metrics, including participation and feedback of the participants, will be analyzed to design the further activities. So basically, we are just generating the 6 months timeline for this first phase. The ultimate objectives of this plan will be expansion of the project to non-English languages, including Spanish, French, Russian, and Chinese. If you go in addition to English, you will cover almost all the world to engage the global representation, to engage with the other projects within SIOP and SIOP continental branches, for instance, SIOP Europe and TELIO in CELOP, and then to actively interact with the key global stakeholders and childhood cancer initiatives, for instance, WHO, GICC, and SIOP St. Jude ARIA project, as Michael has already shared. So these will be the ultimate objectives. So how we will do it? Probably I lost a slide. It will be basically we would be doing we will form a convener group to gear this pilot phase. The conveners, which in the initial proposals, which I shared, I will share with the leadership of SIOP and our CSC, will include SIOP GHN CSG members. Then we would engage SIOP General Secretary as one of the conveners. And then we would pick one disease-specific expert, one each from the 6 WHO index cancers, and one representative from the continental branches, from each continental branches. And also we would take 2 or 3 nominated members from SIOP GHN former leadership, former GHN co-chairs or working group co-chairs. So that will be the composition of the convening group of this plan. So this is what I want to share. Probably, hopefully, it will be very exciting endeavor for all of us, and it will be great thing to do. Yeah, Michael. Michael, actually, I suggested your name, and of course, we need to have you in Saudi Arabia for that meeting in Riyadh
Thank
next year.
you. That's wonderful. I look forward to catching up. Yeah.
Yeah, thank you
This
so
is
much.
fantastic. This
So
is a
that is
fantastic-
yeah, that is this plan. So I would appreciate your thoughts or suggestions further. I have Julia here. She's one of my mentors in GHN on all times. So I have some discussion with her, and also Rajin. She was my first mentor as a leader, as a working group co-chair. And of course, all CSC members, they will gear up this project. So any thoughts or suggestions, I would appreciate.
Well, Sagir, I think this is a very important initiative because as you have mentioned in the SWOT analysis, this came out, education and specific learning is one of the items that the members are looking for. So I really support this project and will be fully supportive, and whatever we can do to support, we will do.
Thank you so much, Rajin. Thank you so much. I really appreciate it. Any further thoughts or suggestions, Julia or anybody else?
Sorry, I had to unmute. I think this is great what you have on the screen. The expansion of the project to non-English languages. I think that was going to be something really innovative. And I think with AI and SIOP adopting this, having last year, I think they began the ability to have subtitles running. We tried it in a Spanish meeting, a Latin American meeting with Spanish, and people said, we asked a spot questionnaire at the end, just put in the chat if it was worth it. We know it wasn't perfect, but everybody just yeses started to come up so fast. So I think if you can really, even if you start to do beyond Spanish, we've done a good job, I think, of exploring doing Spanish, but if you can start including the other 3 languages you mentioned here, you'll see that engagement you're looking for, because the content, no doubt that's going to be excellent, but the access to the content for people who, for them, English is difficult. And I'll tell you, English is a nightmare. I know from having tried to learn other languages, but I think I have a lot of respect for anyone that learns English. So I think this could be the new frontier for SIOP, to say we commit to our members who we're going to support people, to everyone to have access. Don't worry about your English skills. We've got you covered. You too can get the latest and the greatest on the DISC plan programs. And I think you'll see the returns. But I also want to congratulate you on starting to track who exactly is attending. What is the reach of the audience? What are their subspecialties? Because the data will really also guide you. Where are we missing? How are we engaging? Who are we not engaging? And I think that'll help you even more than a SWOT. I think, or at least as important as a SWOT, is to know who exactly your audience is. And I think Cesar pointed that out especially with the partnership, because that's another new way to really engage. And I think with partnerships across the board, you going with SIOP-E, going with other continents, doing the continental one in Saudi Arabia next year for SIOP Asia. I really think the future is bright, and you guys are going to make a difference.
Thank you so much, Julia. Yeah, that's very, very good point. Probably we will discuss with Anelia that maybe we can just reconfigure the registration form, where we can ask the specific discipline from where the participants are coming from. So that one won't need even the survey after the meeting. So we would at least pick, yeah, that's very important. That would be very important information to grab to design further activities. And as you said, for the non-English languages, Guillermo is very keen to engage China and Russia in SIOP. So probably if we reach out to them, even Spanish, there are a lot of SIOP is doing a lot of stuff, of course, but China and Russia, they are quite away from SIOP. So we might have to integrate them, engage them within SIOP, SIOP offerings. Yeah, so definitely we will take on. And probably that if we are able to generate this in a successful way, so it will be a good way of collaborating actively with GICC, and probably that will in the future, it will provide a great support to ARIA also when they will be having something already formed. So we would know the potential beneficiaries of ARIA to implement it. So that's the ultimate goal. Any further thoughts or suggestions? And of course, we need a very close connection with PROS and IPSO. So PROS, we already have Bilal in CSG. So we need to have somebody from IPSO also to collaborate. And of course, let's see if we see somebody from ISOO, International Society of Ocular Oncology. Maybe we can invite Jesse Berry, who is one of the speaker in our session, in disease-specific learning session in Education Day.
Sakir, as Natia has already written, she, as she is the past president of PROS, that's how they can contribute as well. So both Bilal and Natia will be very supportive of the project. And we have had some meetings with the Chinese pediatric hematology oncology group with the leadership because they wanted to reach us, in fact. But as you have said, we want to reach all countries. We have to have all members so that we can implement GICC also. And in fact, this year, we have a lot of abstracts, high quality abstracts from China, especially in the IPSO track, just as a note. Yeah, I think we are engaging more and more other countries as well.
Yes, yes. So yeah, probably we would capitalize by, just providing them their language, if that is possible in that the second phase after the pilot. So that probably will improve the ownership, if we provide their own language in some form of activities generated by SIOP. Right. So we have to discuss a lot more in CSC, but probably it's all, as I said, it's a low-hanging fruit at the pilot phase, and let's see how the things go further. So we need all of you to get on board, and let's do it in a very comprehensive way. So we're just 4 minutes.
Sakir, Anelia has written that we have already in the SIOP Connect that when we have a webinar, afterwards we can track down the members, where they are from, are they members or not, and so on.
Great.
So we already have this opportunity.
But if the participants are non-SIOP member, then probably it will cause a problem. So maybe if we can build a registration page with such like information that will provide us a lot of idea about from where and which discipline they are participating.
Yeah, other than the webinars, maybe, yeah, because I think that will need some more work. Yeah.
So we would have our next quarterly meeting, hopefully in mid of December. And then SIOP Asia 2025, as I said, it's 12th to 15th of April in Riyadh, Saudi Arabia. And Education Day will be on 12th. So save the date on your calendars. It's very easy to get to Saudi Arabia right now. There are very less restrictions for the visa issuance and, very easy to get there. So I hope we would have good participation. And if we have any other points or suggestions before we close the meeting or we go to the virtual photo, because this is the photo which we took last year, I would be missing out of this photo this year, but I hope that those who are participating, they can take a group photo and share with the group so we can use it for the future use. But we can go and put a virtual photo now. But if there are any comments or suggestions, some last points or comments, then we can take right now. Okay, so let's turn on all the cameras. And we don't have Neil today. He's the best person to take the photos. So please turn on your camera. So can we just capture a screenshot? And there are some people in the waiting room. Probably they came for the photo.
Anelia, do you have an opportunity to take the photo? Like a screenshot?
Yes, yes, I
Yeah, I
can.
think
okay.
it will be on the one screen, yeah, because it's only 18 left right now. We reached up till I think 26 at one time. So we can ask Ahmed, Elisa, Fatima, and Natia, Bilal, Rola, please turn on your camera so that we can capture it quickly. Thank you. Thank you, Natia, for joining this meeting.
Yeah.
I really get
So
it.
nice to see you.
Yeah. So
1, 2,
maybe
3. So Anelia,
Okay.
we still have some folks without cameras on. Ahmed, can you turn on? So that's we learned in the COVID era to take the group photos like this. So we replicated here from what we used
Yes,
to do.
Mohammed, I have opened another camera to work.
Okay. Let's go. 2, 3, 1, and go. Okay. So I have taken one.
is it done, Anelia?
Yes, I also took some. Great,
Thank you. Maybe one more now. Rola is also on. Yeah.
Yes.
Yes, I think
Done?
it is
Okay.
done.
Okay, right. Thank you so much, everyone, for joining on Saturday. So we really appreciate, and we look forward to you to contributing in the GHN, and those who are going to the Hawaii. So best of luck, and have safe travels, and have good time and good learning and networking there. Thank you so much for joining, everyone.
Thank you, Sagir. Thanks a lot. We're looking forward to meet you in Hawaii, the ones that will be coming.
Yeah, we'll miss you in
Yeah.
Hawaii. So yeah. Okay.
Thank you very much. Yeah,
Thank
thank
you.
you.
Thanks,
Thank you.
Sagir. Thanks, Sagir.
Thank you.
Thank you.